Hello, everyone. My name is Hassan. I'm an EM trainee. I've posted quite a lot of videos talking about EM training on my channel. And today I thought we'd talk about another training program. And I wouldn't be the right person to talk about it. So I've brought along a friend of mine, Salman, who is a GP ST1 trainee, just started in August. I'll let him introduce himself to whoever is watching us on the channel.
Already done a great job of introducing me. Like you said, I'm Salman. I'm the GP trainee that just started in August. I've started working at Calderdale Royal Hospital, part of the N9 GP scheme. So I'm about 1 month into ST1. Just recently got into training and sat the MSRA, but yeah, Hassan will continue with the introduction of the video. But yeah, he already gave me a nice introduction.
Yeah, so we met in Macclesfield A&E when I was doing my ST1 year. At the time, I believe you were doing a clinical fellow job there. If you were to sort of give us a bit of an idea about yourself, where you started your medical career.
Fine. So I started med school in Bulgaria. I wasn't successful with entering to med school in the UK. So I went abroad because medicine is what I wanted to do, what I wanted to career in. So I went to Bulgaria, a place called Varna. I was there for about 6 years. Completed everything there. In my 6th year, I did some internships in the UK just to try and give myself that clinical experience, the NHS experience, which I thought was quite valuable. And then I'd say license and registration was done by February 2021. I then started working the same year in August 2021 as a trust grade F1. That was the year, all the way to August 22. Then I started as a trust grade F2. I did another year of that. And then from August 23 to January 24, I worked full time as a trust grade in A&E. So 6 months of A&E as well. Just because I wanted ED experience. I quite like the speciality. Hassan clearly likes it. He's an FT3 himself. But yeah, that's essentially where I came to. And then I realized, I need to pick a training program. Where do I want to go? I think GP was the one that was most suitable for me. So that's essentially my journey from, med school to working in the UK. Where GP training and applying for GP training is concerned, I was then decided to locum from January 2024 onwards. But in that time, I was also trying to revise for MSRA in the meantime. I was predominantly using. We'll come to the revision process a bit later, but yeah, I sat the MSRA once in September. I wasn't quite successful. I did pass, but competition being so rampant, I wasn't quite successful the first time. I then sat it again in February 2025. And this time, fortunately, I was successful. And that's brought me to where I am now, I guess.
Fantastic. So when it came to the first 2 years before you started a clinical fellow job in A&E, what kind of sort of rotations did you work in?
So they were all F1 rotations. As a trust grade F1, I was split into 3 different rotations. I know that's not quite common these days. Normally when people are looking for trust grade jobs in the UK, they just give you 1 rotation and you do that for a full 12 months. So my track is not the usual one. Just in case it looks like I'm telling you something and you're thinking, what the hell is this guy talking about? That doesn't exist. But I had 3 rotations, 3 4-month rotations. My first one was also geriatrics mixed with general surgical on-calls. My second rotation was a gen med rotation mixed with medical on-calls. And my third rotation was, you're taking me back now, Hassan. Just a Jerry's ward, a geriatric rotation with medical on-calls again. So that was my F1.
It's a decent mix. Did you do a bit of A&E and F2, and then is that when you sort of liked it and wanted to do the clinical fellow?
No, so F2, actually, I didn't get any A&E rotation. I really wanted one. I did obs and gynae for 4 months. I'm glad those days are over. After that, then 4 months, I then did gen med again with medical on-calls, and then I did endo with medical on-calls. Again, 3 separate 4-month rotations. Because I didn't get an ED rotation, I really wanted ED experience. So then I took out another 6 months after that and did ED for 6 months, trust grade. And yeah, after that is when I decided to start locuming in. Predominantly, 90% of my shifts were ED after that.
Out of
from a locum perspective.
Rotations, do you think there were particular departments or working in particular departments helped you with your MSRA?
ED.
Okay.
if I was to ED, definitely, just because you see a bit of everything. The MSRA, as you guys might be aware, it's a broad exam. It covers everything. So ED experience can help your clinical thinking, your clinical rationale to making decisions in certain scenarios. So ED was definitely probably the most valuable, but also I would say the medical rotations and the general medical on-calls were quite useful as well.
Okay. That's reassuring for people who, don't particularly have an option to work in many different departments. But I think medicine and A&E covers most of what you would need. Now, why did you pick GP?
Good question. So, based on how much I've spoke about ED, you'd think I'd be sat maybe where Hassan is right now, because I do actually enjoy ED. I'll be honest with you. I did enjoy. Yeah, what a shame, But the thing with ED that kind of put me off during that 6-month rotation, if I'm being completely honest, was the rota. The rota is, well, I'm sure Hassan will tell you, is, it's terrible. It's a horrible rota. It breaks you down. It makes you question life choices. But it is a good career. It's a rewarding career. But the rota just wasn't for me. So I actually enjoyed ED so much more when I was in my locum year, because then I was picking shifts up, and hours up that I wanted to work out, rather than just being subjected to doing three sets of nights, like 3 weeks of nights in 1 month. That's not what I wanted to do, really. So I picked GP. Going back to why I picked GP is because I think GP provides a bit of flexibility. I think a lot of GP trainees, especially who become GPs, are not subject to being GPs for the rest of their lives. I think they can branch into quite a few different things, whether that be incorporating business into the medical field, from trying to become a GP partner or various other businesses. I know GP trainees myself that have become registrar level ward level registrars, like on general medical wards, straight from GP training. No training after that. I know GP trainees personally that work as a registrar in ED, work as registrars in ED. So it does provide a bit of variety, and the training program is quite short. It's only 3 years. And if you really had an interest in one particular area of medicine, you can always do an extra year as a special interest, whether it be dermatology, minor surgeries and stuff. So I love the flexibility of it. And I also love the fact that the training program is quite short compared to other specialty training programs.
Yeah, fair enough. Sounds like it's got a lot of prospects after you finish the actual training program as well. So
a lot of doors open.
Yeah, that's good. When it comes to the application process for GP training, if I was somebody who knows absolutely nothing about it, and you were to just sort of simplify it for us, how did it start? What are the sort of steps?
So application process, if you're applying as an IMG, which is technically what I was, is that what you're referring to? Or could it would be different for UK grads? But I'll tell you my perspective.
I would say
first,
so, because the IMGs would always have 1 or 2 extra steps over a UK grad. So you're essentially covering both by answering.
Yeah, fine. So as an IMG, you would need to make sure, first of all, you need to have this document, you may have heard of it, called a CREST form. Essentially, that's the important thing that you need to get signed off. If it's particularly for GP training, you don't need a portfolio. You may be hearing a lot of people you're working with talking about portfolio. There's CPDs, mini KEXs, all that sort of stuff. For GP training, it's not necessary. All you need is a CREST form. A CREST form is essentially an assessment of your competence, and the person who signs that off for you is a consultant you've worked closely with for at least 3 months, if I'm not mistaken. And they'll sign that form off for you to pick the various competencies that they've observed you do, and that they're happy with you, and you upload that onto your application process for GP training. So once you've got that CREST form, you can start thinking about applying for GP training. Then where the application is concerned, just like the other doctors who have graduated from the UK, you would go on a website called Oriel, ORIEL, and just like them, you'd fill in all the necessary details, where you graduated from, your personal details. You'd upload your CREST form there, any other sort of competency proof of competency documentation that may not even be necessary, that you just may have, like ALS, for example, ILS, BLS, maybe. Yeah, so it's pretty much a tick box thing from that point onwards, just filling out all the necessary details that they require. The only thing you need to get for them is the crest form, and then upload that onto the Oriel application.
What month of the year is it usually to apply for the actual first step? And
good question.
It's roughly, it's been 3 years. I'm not certain myself.
Yeah, it's been a while. There's two application entries.
Okay.
With the two starting dates for GP training, the standard starting date being August, and they also have a February intake as well. So the application process opens up at different times, obviously, for different windows of entering training. So for the August intake, the applications would open up. I just did this now, I should remember. They open up in, if I'm not mistaken, end of October, November.
Oh, sounds about right, yeah.
Yeah, around October, November. And then once the application window is open, obviously you've got the necessary time to fill everything out and upload anything you need to upload. And then it closes. I think, if I'm not mistaken, I think mine closed in December. And then after that, what happens is, I'm specifically talking about August intake, what I've just done now. What happens after that is you then wait for them to get back to you about whether your application is successful, and then closer to the exam time, you're able to book specific dates for when you'd like to take the exam. This time round, because there was so many applicants, because competition just keeps on rising, they actually had two separate sessions.
Right.
They had January exam takers, let's say, and then they had a separate session for people sitting the same exam in February. So two windows for August.
When you mentioned February, I thought I'd done it in January, and I thought, did they just push the date back? It sounds...
They literally, because there were so many, I think there was, if I'm not mistaken, there were 25,000 people who sat the MSRA this time round for August 2025 intake. Yes, it's crazy. So that's why they put an exam window in January and then also an exam window in February, both for August intake. And both them exam sessions were for the same MSRA exam. It's because there were so many applicants. Usually, Hassan, you're right. This is the first time they've done it.
Right. And you might not know this, but just wondering, for the February take, can they use the scores and application that you had applied for August if you didn't get in, or do you reapply and resit the exams and everything?
Great question. If I'm not mistaken, if it's part of the same round, so I've heard two things. I don't want to give the wrong advice, but I've heard two things. One thing I've heard is, if it's part of the same year, for example, August intake is classed as round 1 and February intake is classed as round 2. So your round 1 score you can carry to round 2. That's the first thing I've heard. The other thing I've heard is you can hold your score and keep it for 2 years.
Okay.
But this may be wrong.
The second option is probably going to go against you as it becomes more competitive. Your good score becomes not very good.
Yeah, because the good scores these days are not so good anymore. The way things are going, you know. I know people that I don't. This is not to make you feel bad, because it was also quite hard for me to hear at the time as well when I didn't get it the first time. That got scores significantly lower than the score that I got for my application for February 2025 intake, when I sat the exam last September. And I know people with significantly lower scores than the one I got then, and they got into Manchester with those scores, with scores lower than mine. I know someone, I think that they got into, I don't want to, I'm not going to name names. Yeah. I'm not going to name names of co people.
But that's strange, because because from what I understand now, so GP training predominantly just depends on your MSRA score. So I think that people would lose.
Yeah. Predominantly based on it's predominantly based on your exam score. They don't even look at the quality of the quest form. The quest form is the same for all the IMG applicants. It just needs to be signed. It's just the score that matters for GP.
Yeah. Okay. And when it comes to the MSRA itself, so you've done it twice now. How did you find the first time? What did you sort of learn from the first time?
Okay. The first time, I just use a platform which I'm sure most of you have heard of called Past Medicine. It's probably the most popular, well-known, question bank out there. It was very good. So I said predominantly I only use Past Medicine for when I sat the exam last September. It was great, especially for acquiring knowledge and actually understanding and learning the material. And it did provide me with a good score where I passed, but it just wasn't quite high enough. I, wasn't too impressed with. I think a lot of the Past Medicine questions include a lot in the actual body of the question compared to how the exam, frames their questions. The exam questions, from what I found, were a lot shorter. The body was a lot shorter. The stem of the question was a lot shorter. It might have just been 1 or 2 lines or a quick fact check question that you'd get on the actual exam, whereas Past Medicine, sometimes I'd be reading an essay before it gives me 5 answers to choose from. And, that's not how the exam was at all. But I'm not saying Past Medicine's a waste of time, because I still used it second time round, because it does provide you valuable knowledge. In terms of actually learning the knowledge, I would 100% advise Past Med. For the second time round, I then decided to pick a question bank that was more similar to in terms of style of questions, to the exam. And from research and reading, threads on Reddit and talking to different people who were successful, the one that I found was the most successful, the one that I found that was the most useful or similar to the exam, was one called MCQ Bank. There are other ones out there. Some people mentioned Samson Mock. Someone mentioned eMedica, but I was never going to do 5-10 question banks.
Yeah.
Sorry, I wanted to get into training, but I wasn't going to do 5 question banks.
We're trying to give honest opinion over here, not just scare people by giving them a load of information.
No, not at all. No, I'm not going to tell you to do that many question banks. But what I would say is it's definitely worth doing more than 1 question bank, and I would advise 2. And the one I would definitely advise Past Medicine. And I would then advise you to supplement that with a question bank that is similar to how the exam style questions are. And from my experience and from my research, that was MCQ Bank. Other people have quoted other ones like Samson Mox or but I used MCQ Bank, and I would say the questions there were similar to the exam from my experience. So yeah, I supplemented the knowledge question bank and gained my knowledge from Past Medicine with exam style question bank being MCQ Bank, and that was the key difference for me. And obviously, another key difference is the fact that, I already sat the exam once, I already revised once. I'm not going to pretend like if you just do MCQ Bank, you're suddenly going to become a genius and pass the exam. I got the experience from not quite being as successful as I wanted to be the first time, but still all that residual knowledge in my head, trying again with different methods, implemented with it being another question bank, practicing the SJT a bit more. That definitely was useful. Don't neglect the SJT. It's the only thing I'll say. It's 50% of your mark. Don't just assume it's just common knowledge and you can't really revise for it. You can, to an extent, but you definitely can. So don't neglect that part.
Yeah, for the people who are sort of new to the UK, SJT, situational judgment test, I want to say, is what it stands for.
Yes, situation.
It is predominantly managing scenarios that are not necessarily medically relevant to the patient, but either socially important or in terms of actual safe practice, colleagues, issues at work and stuff like that. And because as IMGs, we don't get that part of training in our medical university, we tend to struggle with it more than UK grads. So it does need actually a bit more work. Most of us are medically quite good. So with a bit of reading and a bit of practice, we can manage the medical part. But I think the SJT is really important. And it sounds like the MCQ Bank does a good job at that.
Yes, MCQ Bank definitely does a good job of that. Even the Past Medicine ones are not too bad as well. I would just advise doing as many of these questions as possible and finding some online, even past papers from medical school, from UK medical school, just as many of these questions as you can, just to try to get into the examiner's mind about how they want you to think.
Were there any particular medical sections in the exam that you found a bit more difficult than others, like gynae or ophthalm, I don't know, peds?
I suppose that's subjective because, people, when they come out of med school, might be stronger in a particular area of medicine compared to others. I didn't have a clue. about ophthalmology and some of these maybe more niche specialities. So revising for them was quite difficult because a lot of the stuff I was reading and trying to, ingrain into my mind and understand wasn't so familiar to me compared to, for example, a lot of the medical subjects that maybe I might have encountered on calls or during work, or things that I would have encountered in ED that I was just it was easier for me to understand. But a lot of the niche specialties, I'd say, I found quite difficult. Ophthalmo, for example, learning out the different types of, antibodies for all these different diseases. I mean, you don't do that at work,
Yeah.
So those were probably the more difficult ones for me.
The reason I ask is because now there's such a fine line between people getting in or not, that every couple of points might make the difference for you getting into training. So trying to maximize the points from sort of the difficult topics might make a big difference.
No, definitely. Everything you can do to maximize your chances of getting in, it's fine margins now these days with competition being so high. So you want to put yourself in the most advantageous position as possible, and you're only going to do that by, covering fine tuning these little things that's in your control to give yourself the best possible chance.
Yeah. The second time around, you were studying for it while locoming instead of doing a full-time job. Is that right?
Yes.
I'm sure that made a load of a difference when it comes to how many hours you were able to put in. But if you look back at the first time you went for the exam, because most of the people that are listening to this might be either an F2 who just wants to get into training directly, or an IMG who can't necessarily locum due to visa issues and things like that. If you were to go back in time, still have a full-time job in A&E, how would you play around with the timeline and how long you would actually give for the exam?
Okay. I think if you're in full-time work, but by the way, for this exam, I don't think there's people like to give a specific amount of months. I don't think there's even a limit to how much you can actually revise for this exam. There's always something you can do, so I would just advise people to give themselves as much time as possible. Okay, with limits, I'm not going to say start revising for years, but definitely, I would say if you're in full-time work, and you want to pace yourself out a little bit, you don't want to stress yourself out too much. I would say 6 months is quite reasonable. Yeah. That's provided you're in full-time work and stuff. So I think that's quite a reasonable amount of time to take out. If you're locuming and you have a lot more free time on your hands, I think you can probably do it in 3-4 months, for example. Yeah. If you really knuckle down. Obviously, people's baseline is different as well. So I don't want to use this as a rule of thumb because, everybody knows their starting point. If your starting point isn't really that strong, I don't think mine was the strongest either, if I'm being completely truthful, then you obviously need more time. But you'll only know that by at least maybe downloading the question bank and seeing, maybe just do 50 questions and just see, where you're at and how hard you found it. Based on that, you'll kind of know how much time to set yourself. But yeah, I think even if you need more time and you're a locum doctor, then take more time. But don't be afraid of sitting the exam as well, because that's also practice.
Yeah, absolutely. I would say, like you mentioned a very nice point, which is to check the question banks quite early on. And if you are somebody who finds it really easy, I mean, fair play to you. Take 2 months if you want. Go for it. No hate at all. But the advantage of
there's no point in me.
The advantage of having a look early on is if it was the other way around, which it was for both of us, because we were sort of IMGs, different system, and it also takes a while for us to get our license and start to work. And in that time, we do lose a little bit of medical knowledge. So when we do start in the NHS and are working the whole time, and the first exam comes by, you do need to do a lot of refreshing at the start. I personally took 5 or 6 months for it, and I have no shame in doing so.
I had no shame. But the whole process for me was a year, because I tried for 4 months while I was locuming and I didn't get in. And then by the time the exam came around the second time, it was probably another 6 months. So, the whole process for me was about 10 months. I've got no shame in saying that.
Yeah, so it sounds like the biggest differences for you not getting in the first time and getting in the second time is freeing up a little bit more time to actually revise and picking your right resources, essentially the bottom line for it.
Yeah. they were the two key things. Maybe as enticing the locum money was, because I knew how much I could be earning, working instead of sat there learning about, I don't know, chorioamnionitis, or let me think of another disease, maybe there were some of these rheumatological antibodies that we look for just for specific diseases, or Sjogren syndrome, for example. I was thinking to myself, I could have been earning a lot of money working today, but it's necessary. I mean, money's not everything. Money comes and goes, and this is a process essentially that's going to take you to a platform where, if money even is your incentive, you're going to be better off getting into training and eventually completing training anyway. So setting more time aside to revise, even when you are locum, I think is definitely important. It's something I definitely did second time round compared to first time. And yeah, that's that. You hit the nail on the head, where you said a choice of resources and more dedicated time towards studying. So those are the best things probably the only things I can tell you to do.
Fair enough. I don't want to take more of your time. Thank you for coming in today. It was, first of all, good to see you, because I have actually not seen you for months. So it was a good excuse.
Yeah, Hassan doesn't like me anymore. He just told me to come here just to help him out with this interview, but he didn't really message me, ring me. He didn't like me.
Just finish the interview and then I won't message you again. If you've got any more questions later down the line that we've not discussed, feel free to drop us a question either in the comments or by email. We're happy to answer more questions. And thank you, Salman, for coming today. I hope to see you soon.
Hassan, hopefully we'll sort something out soon.
Cheers. See you, everyone. Take care.
Take care. Bye.